Home health nursing is a specialty area of nursing practice that promotes optimal health and well-being for patients, their families, and caregivers within their homes and communities. Home health nurses use a holistic approach aimed at empowering patients, families, and caregivers to achieve their highest level of physical, functional, spiritual, and physiological health. Throughout the script, we will be demonstrating the importance of good communication skills and proper patient care.
Hello, this is Crystal Senior Care. Nurse Crystal speaking.
Hello, I'm currently looking for a nursing job in a home health setting. I have experience from working at the local hospital here in town. Are you guys currently hiring?
Yes, we are hiring. Home health nursing is a lot different than what you are used to. Home health nurses practice independently and require highly developed skills and assessment and care coordination. They must be an expert in assessment, clinical decision-making, and clinical practice. Remember, the main goal in home health nursing is to improve the patient's quality of life.
That sounds like something I'd like to do.
Okay, well there is one patient named Mar who currently does not have a nurse assigned to him because the previous nurse is on maternity leave. If home health nursing is something you're absolutely interested in, you're hired. He has a son named James. Currently his son is the caregiver. It is important to keep him informed and communicate with him on a daily basis.
I'm capable of meeting all these requirements.
Great, welcome to the team.
When can I start?
I was actually heading to Mar's house right now. If you're up for it, you can start today.
Awesome. Thank you for this opportunity.
In this scene, the nurse and graduate nurse arrive at the home and are invited in by the patient's son, James.
Alright, Bailey, certain distinctive characteristics of a home health care environment influence patient safety and quality of outcomes. Home health nurses do quite a bit of paperwork and reimbursement issues, aside from routinely visits.
I see. So home health nursing is mostly just paperwork.
Not quite, Bailey. There is a general misconception people have. Everything we do, from medication safety to basic routinely procedures, is entirely for the patient. All fields of nursing have paperwork. However, the relationship between nurse and patient here is unique compared to other nursing fields.
All right then, I see.
I'll explain as we move along.
Hello, good morning nurses. My name is James. Welcome to the Caleb residence. I've been up all night trying to calm my dad down. He has been having episodes of his previous experiences during World War II. Thank you for coming out today to help me with my dad.
Good morning, James. I'm sorry that you had a rough night. By any chance, did he take his medication?
I have been insisting for him to take his medicine. However, he has been stubborn.
I see why he's been acting up. Maybe some Namenda will help him calm him down. Let me talk to him.
Namenda is a medication that is used to treat moderate to severe Alzheimer's.
By the way, this is the nurse that will be shadowing me. Her name is Bailey.
Here we see how the nurses assess the patient, Mar. In home health nursing, it is especially important to connect with the patient because this enforces optimal care. A strong connection between the patient and nurse creates an understanding that the nurse has the patient's best interest at heart.
Bailey, this is Mar Caleb. Mar has stage 4 Alzheimer's disease and secondary hypertension. Today we will be going over the basics of how to care for Mr. Caleb. Okay, Mr. Caleb, how are you today?
Who are you? Where is my son? Have you seen him?
He's been taking care of you, but right now we're here for your routinely checkup.
I haven't seen my son since 1939. What is he?
Hey Dad, remember this? This was us at IHOP eating bacon and eggs after he came back from the war.
I love bacon and eggs. James, you're so big now.
Alright, Mara, ready? I'm going to be taking your blood pressure on your left arm. Can you sit up straight for me?
Okay.
The nurses then follow up and clarify procedures to both the caregiver and patient. It is important to encourage prevention of illnesses through healthy practices.
James, how was your father's meal plan? Has he been eating regularly, and what kind of food has he been eating?
He's actually been eating well, 3 times a day, and I have been writing a daily food log to keep track of his meals.
Okay, so since he has hypertension, it is vital to give him healthier options such as lean proteins, whole grains, fruits, and vegetables.
Within home health nursing, it is important to carefully evaluate charts and paperwork to make sure that there are no potential mistakes to be made.
Okay, so we're just about done here. Let's check if Mar's medications are correct and finish our paperwork. Actually, I'll let you do it, Bailey.
The nurses approach the patient and his son to go over Mar's daily medication. They express what the patient should do in order to remain healthy.
Alright, Bailey, I hope you enjoyed your first day on the field of home health nursing. How do you think it went?
I think it went well. I learned a lot about this particular field, and I feel like this could be something I would really enjoy.
Great, I'm so glad you enjoyed it. You and Mar will get along just fine.